So this is a patient that presented to office complaining of significant pain to both feet, but more specifically to the right foot. As you can see, he had this huge, what we call hemorrhagic callus tissue to the underneath the first metatarsal head area of the right foot. This is generally the result of pressure. This is a significant pressure point for the patient. The body reacts to that pressure to form a hard callus, and if that's left too long, then it becomes what we call hemorrhagic, so the breaking down of capillaries to that area. This is significant because if left even further, then it can further break down, and then it can cause a open wound to that area. So it's important to get all this hard tissue off. And this video is showing you how we do that. We soften the area first, and then we use a blade, a number 15 blade, to delicately shave down this tissue, and then contour it again back to its original form. We always tell patients that this will always come back as long as you're on your feet. This is a pressure point, so it'll always come back. There are ways to prevent this coming back so quickly, using good supportive athletic shoes. Sometimes custom orthotics that will offload that area focally is a good idea. And then there's general maintenance, like using a pumice stone when you get out the bath or shower to this area when the skin is nice and soft. You can also use a urea-based moisturizer, which will break down some of that hard tissue as well. But generally, patients do well with shaving this down. Again, when it is to this extent, we do tell patients to monitor very closely, because it is close to breaking down that tissue to an ulcer. We shave it down with the number 15 blade, and then smooth it up with a Dremel, and patients do very well.
Shops and patisseries and that,
all that stuff. Just Suzanne was still sleeping, back about 7:38, and then we'd stay out to God till 1 o'clock in the morning, and take that little by the Eiffel Tower, the cruise of the canal. At night, and we really had nice times. Our friends asked if we want to go with them. They're going to go for a month, and most I would go is like 2 weeks.
Sure. Yeah, 2 weeks is, you need at least 2 weeks, I think.
Yeah. We always end up, 2 weeks, but it usually ends up being like 10 days there, and then 2 days traveling.
Traveling,
4 or 3, it's always